Hey, let's talk about the vagina today. The reason why we keep getting infections and they keep coming back, the foul smell, the discharge, the itching. The first thing you need to take note of is that you should stop washing and hanging your underwear in the bathroom and the toilet where you have your shower. When you want to wash your underwear, you wash, you rinse, you disinfect with Dettol or any antiseptic you put in the water, you rinse, and then you re-rinse with clean water and you sun dry. You sun dry. And if you don't have access to the sun, you can use your iron to quickly iron the middle part of your panties. Now that's critical. The next one is the vagina has a delicate balance, a pH system that works. It cleanses itself. You don't need to dip medicated soap, dip your hand douching into it. That upsets that balance and that makes you prone to infections. And so when you wash the vulva, you wash, your labia, you pat that gently and you use warm water or a washcloth and you wash. That's fine. Washing, the outside is fine. Don't dip anything inside. If you must use soap, use baby soap, not medicated soap, nothing strong. Baby wipes is fine for when you want to have a quickie, and all of that. So you just wipe. And when you wipe, ensure you wipe from the front to the back, not from the back to the front, so you don't introduce bacteria from the anus into the vagina. And when you use tissue to wipe, after you use tissue, try and form the habit of using water to rinse down there. Yes, even when you pee, always ensure that you rinse with water. If you don't have access to that kind of sitting down and washing position, you can use tissue paper, soak it a little water, and dab. When you now get home, you settle down, you wash properly with warm water. The next one is you dry your vagina well. Every time you wash, don't leave any residue water there. Make sure you clean it properly so that remaining water does not mix with sweat and all of that, and then it issues an offensive odor. So you wash and dry properly. The next thing is to wear cotton soft underwear, breathable underwear, where your vagina can have fresh air. No thongs, no tight undies, and no sleeping with underwear. The next one is when you perceive a foul smell, you suspect an infection, don't self medicate. Go and see your gynecologist. They are there for a reason. Now, use the opportunity to also do your pap smear test. It's important. You check yourself yearly at least. And when you see your doctor, please treat your partner alongside yourself when you're getting treated. Especially, when you have other wives, you're not the only wife. You make sure that you all treat at the same time. And then when you're treating an infection, please don't have unprotected sex. Wait until you finish your treatment. And when your doctor gives you medication, especially antibiotics, make sure you finish the full dose. Don't stop when you feel better, because if you do, your body might form resistance and that medication might not work for you next time. So ensure you finish the course of the treatment properly. And then another thing is, please ensure that you regularly check on your it's yours. Don't be ashamed or don't feel dirty about it. You check regularly. You smell down there. You check. You ensure that it's doing well. It's breathing fine. It's smelling nice. And of course, the food you eat also matters. Cigarette smoking should be out of it completely. Please share this video. I love you as always.